To other stories now, former president of the Nigerian Labour Congress, Ayuba Wabba, has criticized the tax reform bills, warning that there will be severe consequences for workers, especially on the proposed annual increase in value-added tax. Ayuba Wabba spoke at the inauguration of the newly elected State Council Chairmen of the Medical and Health Workers Union of Nigeria.
It's a mandate to represent their interests and also represent them very well. So while congratulating you, it's also to charge you, to say that the baton has been handed over to you by previous leadership. We expect you to make a mark by quality representation. Medical and Health Workers Union for some time have been known to provide quality leadership, and therefore none of you should be found wanting. You must make sure that you are able to represent our members in your various states effectively, and also try to make sure that you are able to reflect the good image of the union.
Everybody knows that members of Medical and Health Workers Union of Nigeria are very transparent in the discharge of their responsibilities. That means that if you do good, we'll compensate you. And if you do the other round, you will have a punishment. It's one of the union that we agree that once we digress, especially on the financial policy of the union, we will take the necessary action.
And to health now, as part of commitment to enhancing wellness and healthcare in the state, the Lagos State government has provided electronic medical records to ease patients' waiting time and ensure a seamless process at the clinic. Inioluwa Kubola has more in this report.
Today in Nigeria, according to health reports, an estimated 1 million mothers and children die each year from preventable deaths. Through Saving 1 Million Lives program, an initiative that came about in 2012, it has set new goals to improve quality health care and save the lives of 1 million mothers and children. The Lagos State Ministry of Health, in collaboration with this program, has now made life easier for patients in the Folarin Koka Staff Clinic, formerly called the Lagos State Government Staff Clinic Complex, by introducing electronic medical records and solar power.
The whole idea of electronic record keeping is that when the patient comes to one place, all the records are in one place. If they go somewhere else, the same records will follow them. They don't have to remember anything except they're presenting complaints, because we already have their history, their data. And also for the patient, they will feel more that we know them. We have not forgotten about them. They don't have to remember every single drug or the dosage that they had, because it's on the record. Their records are not missing. We don't have to rely on, they always say doctors and nurses have the worst handwriting. This removes all that.
It gets in quicker in hospital because it's just a matter of hitting a button, your name comes up, your records are sent to the doctor, you will see. So very little paper, so we can use our spaces for much more useful things than storing files.
One of the aims is to reduce the patient's waiting time and grant them easy access to their files anytime.
We all know that in the recent times, the power supply has been very erratic, and then that's why they've come in to actually help us do this. And in doing all of this, they've been able to strengthen our service delivery in the facility. Also, we've also, as part of what they are doing, also, they've also supplied us with computer hardwares, UPSs, and the rest of them, also to be able to help us just have a seamless interaction with the EMR system, both for the doctors, for the health workers and the patient.
As the meeting came to a close, these health experts advised that information provided from the medical records should be prompt and the equipment be maintained properly. Inioluwa Kubola, TVC News, Lagos.